everyone, my name is Jana Eissa, and today we'll explain the initiation of labor. But before we start, we need to be able to differentiate between what is parturition and what is labor. Parturition is giving birth to a baby anywhere between 15 days from the expected due date. So could be plus or minus 15 days from the expected due date, whereas the labor are the series of events that expel the infant from the uterus. And today we'll delve deeper into the initiation of labor itself and the steps. So, the first thing that happens is the maturation of the fetal hypothalamus. So, the fetal hypothalamus, as it's maturing, it's going to increase the release of the hormone CRH, which is corticotropin releasing hormone. Now, with the increase of fetal CRH, that's going to cause the increased release of fetal cortisol. Fetal cortisol is released from the adrenal medulla of the fetus. So the maturing adrenal medulla is going to start to release fetal cortisol, which is then going to lead to an increase of the placental CRH. So there are two sources now from CRH, one from the fetus itself and one from the placenta. But the one from the placenta, you need to remember that it is induced by the increased release of fetal cortisol from the maturing adrenal medulla. Now, as you can see over here, there's a positive feedback cycle. As the fetal cortisol level increases, it increases the level of placental CRH, and this causes an increase again of the fetal cortisol. This cycle that we call over here is a positive feedback cycle. And the way you can remember it is that both C's are helping each other. One is from cortisol, one is corticotropin, and they're best buddies, and they're trying their best to support each other. This resultantly causes fetal cortisol levels to increase, and that has a lot of importance. So, the first important thing that an increased level of fetal cortisol leads to is that it triggers the final maturation of the lungs. So, for example, for premature babies, usually their lungs are not mature enough because the fetal cortisol levels are not high enough to cause the maturation of the lungs. Another thing why high fetal cortisol levels are important is due to the production of surfactant protein A, which is a very, very important signal to basically tell the baby, come out right now. So these two things are very important things that need to happen when the fetal cortisol levels increase. Now, with an increase in the fetal cortisol level, this induces an increase in the placental estrogen levels and a decrease in the progesterone. Now, here's a question to you. Feel free to pause the video and ask yourself, why do we have high levels of progesterone throughout pregnancy? What is the function of essentially progesterone throughout pregnancy? The answer is that progesterone helps suppress contraction of the uterine smooth muscle to prevent preterm labor. So, if we have low progesterone levels, this could lead to the contraction of the uterine muscle, which could lead to preterm labor, which we don't want to happen. Now, the increase of estrogen and the decrease of progesterone aids in three different things. First thing is it prepares the cervix for dilation. It also prepares the myometrium for contraction, and it increases the sensitivity of the myometrium. So let's have a look at each one more closely. First factor, it helps prepare the cervix for dilation. And the reason being, with the increase of placental estrogen and a decrease in the progesterone, it increases the release of prostaglandins from the placenta. And the prostaglandin is very important in the initiation of labor because it helps to thin and soften the cervix, which is very important to allow the baby to come out. Another thing that is very important with the increase of the placental estrogen, it causes an increase in the prostaglandin and oxytocin receptors on the uterus. And we know we need these receptors so that the prostaglandin and oxytocin can bind to, so an actual response can happen, which is the contraction. So without these receptors, even if we have the prostaglandin and oxytocin, if they can't bind to a receptor, no resultant action is going to occur. So hence, the increase of placental estrogen and the decrease of progesterone helps prepare the cervix for dilation. The second factor is that it helps prepare the myometrium for contraction. Why? Because it increases the synthesis of contractile proteins such as actin and myosin, which allows more cross bridges to be formed, so therefore allows for a greater contraction or a more forcible contraction. It also allows for more gap junctions to be formed between the myometrial cells, which allows the myometrial cells to be connected to each other electrically, allowing for a greater contraction. However, this could lead to the irritability of the myometrium, which can lead to something that we call the Braxton Hicks contraction. Braxton Hicks is weak, irregular uterine contractions, which are actually an indication of false labor. It's not true labor. So, if a woman experiences weak, irregular uterine contractions and goes to the hospital, the doctors will inform her that she's going through false labor and the baby's not going to come out right now. So, due to the irritability of the myometrium, it leads to Braxton Hicks contractions. The last impact of the increase of estrogen and the decrease of progesterone is that increases the sensitivity of the myometrium. And again, as we said earlier, this is because there are more receptors now for both prostaglandins and oxytocin, which allows them to bind to, and this overall increases the sensitivity. We talked about false labor, but what leads to true labor? Well, an increase in the prostaglandins released from the placenta itself is the one that's going to lead to rhythmic contractions or true labor, essentially. And this will therefore stimulate the uterus to contract. If the uterus is stimulated to contract, this will lead to the cervix to stretch. And then with the cervix stretching, it will cause an increase of the oxytocin released from the mother's posterior pituitary. Because basically, the hypothalamus is going to be alarmed that the cervix is being stretched, which is going to send signals to the posterior pituitary to release the oxytocin. And as you can see over here, we have another positive feedback cycle. Cervix stretches, more oxytocin released will stimulate the uterus to contract, cervix stretches again, and so on and so forth. So we have two really positive feedback cycles occurring here. One between the fetal cortisol and the placental CRH, and one over here stimulates uterus to contract, cervix stretches, and then there's an increase in the oxytocin. And again, there could be another one here if you think about it. So, prostaglandin from the placenta increases the uterus to contract, which then further leads to more prostaglandins to be released. Now, what can interfere with the initiation of labor? Anything that interferes with prostaglandin, which is essential for the initiation of labor, like for example, antiprostaglandin drugs, are going to interfere with the initiation of labor. And hence, women, for example, that are in risk of preterm labor are given antiprostaglandin drugs in order to prevent the initiation of labor. Here's a question for you to try out. Pause the video and wait for me to tell you the answer. So the answer is A. Why? Because we do need the secretion of oxytocin, we do need contraction for the onset of labor, and we do need high estrogen levels and low progesterone levels. So even if you didn't know, aspirin and similar drugs are not involved in the onset of labor, always use the process of elimination to help you find your answer. Hope you find this helpful and see you in another video.